You know, when you're arguing with somebody and you can just leave the room when you're tired of arguing with them, you can't get those voices out of your head. They're always around.
Those voices led Renshawn Miller down a dark road.
But today he's proof that there is help and hope for people who are facing mental health issues. He's now a role model for young men across Charlotte, and he talks openly about his own issues.
Our Brittany Johnson saw firsthand how that helps others struggling to manage theirs.
It was my sophomore year in college.
College should have been the best time of his life, but when an injury forced Renshawn Miller to quit football, things started falling apart.
I was having trouble sleeping, and that's when the actual voices started.
His mother could tell over the phone.
She sent my cousin in to check in on me, and when my cousin saw me, I hadn't showered in a long time. I was very skinny, and hair was all over the place. And she was like, "You're not the Sean that I know."
Doctors diagnosed Miller with bipolar I disorder. He attempted suicide 3 times, twice with pills, and then
I put a gun in my head and pulled the trigger, and it jammed on me.
It was also the turning point. Now, every day, Miller is determined to become what he calls the person he needed when he was younger.
I needed a male figure to tell me that it's okay to hurt. It's okay to show that emotion. It's okay to cry.
We met him at MLK Middle School. He comes here every week in t-shirt and sneakers, spending time with 7th grade boys, trying to relate to them. How do you do that?
Being genuine.
Okay.
You know, I share parts of me.
He asks about bullying, about problems at home or social media, and talks about healthy ways to cope.
I've dealt with children who witnessed their friends murdered in front of them. Some kids, they may want to take their lives, or they may want to take lives of others. It's easier to impact the kids now and not allow that stigma to be, enforced on them, and then they pick up those habits.
We all need to be more aware of our mental health.
Principal Jennifer Dean told me Miller fills a subtle but powerful void in her students' lives. He's a counselor who looks like them.
Because a lot of our kids are very closeted. They don't share. And certainly, one reason is because no one really asks.
Hey, I got somebody I want you to talk to.
Behavioral modification technician Corey Gaines says since Miller started volunteering here, suspensions are down.
I have teachers approaching me like, hey, since such and such has been seeing this person, he's more vocal in class. He's more respectful in the halls.
Through his nonprofit, Eustress, Miller has taken his message of mental wellness to audiences across the country. He wrote a book and speaks on the radio.
It's a chemical imbalance in your body.
In this 2017 interview, he reunited with the doctor who treated him for bipolar disorder, breaking down myths about medication.
Yes, there are side effects, but then also I understood that if I didn't take my meds, I'm constantly hearing these voices.
Miller has taken various medications and he's seen therapists who've helped him manage his stress. Now, he's trying to make sure others get the same help.
We can definitely connect.
And his reach is growing. Every year he organizes a mental health awareness walk. The message, let's talk about it.
It's going to take a village to address all of these issues. Even the work that I do, I definitely can't do it by myself.
13 years after voices in his head first told him he had nothing to live for, he is using his voice to let others know there is help and there is hope.
I definitely know my purpose.
And Renshawn says that since intense stress is one of the things that can trigger bipolar disorder or other issues, we need to remember to treat our mental health the same way we do our physical health. That means talking to a doctor, to a counselor, getting a mental health wellness check. That's what he's doing right now, being that person someone can call. He's one of the mental health professionals in this room right now. As people call our hotline, our helpline is open until 10 o'clock tonight, and you can call, get answers about where you can go for resources. They have a county by county guide here that can connect you to agencies. This can be for you or someone you love. The number right there on your screen, 1-800-950-3739. There is help and we can get you connected. Scott, Erica.
All right, Brittany, thank you. Now a very sobering statistic. There were more than twice the number of suicides in the United States than there were murders in 2017, more than 47,000.
It is a heartbreaking number, and even more disturbing knowing that in some of those cases, access to treatment could have saved lives.
But a lot of families have trouble convincing insurance to actually cover the treatment.
Jason Stujenki has the story of a teenager who struggled with depression and had so few choices that she wrote a letter begging for help.
My name is Ash.
This is one of the last videos Ashlyn Hafner made of herself.
And I got a new thing. And it's a GoPro. And I put it on my guitar and it's really rad.
Look how witty, personable, and talented. Which makes her story even more heartbreaking.
I had found some photos in Ashlyn's phones depicting self-harm. Very deep wounds.
Being a troubled youth, I'm often tempted by things that could kill me.
April Quick talked about it with her daughter, but Ashlyn's depression and anxiety grew. When she got to high school, she also struggled with her gender.
She was trying to figure herself out and fit in.
Then, February 25th, 2015.
She wasn't in her room, so I immediately went to the front door, opened the front door. Some lights right at the front of the neighborhood kind of caught my attention, and I ran and had saw Ashlyn laying on the side of the road. She had ran in front of the car that was coming down the road.
That's how Ashlyn took her own life. She was 16 years old.
I'm so tired of the rain falling softly on the ground.
There's no words to describe how much I miss her and just the hole that's been left in me. I mean, I'll never be the same.
I find my inability to breathe rather soothing because
There was a lot of struggles trying to get the services.
April Quick had insurance, Medicaid, but still.
There was a lot of roadblocks that we would hit. There was a lot of rejections. There was a lot of denials.
Ashlyn had wanted to go to a 6-month inpatient program. Quick told me with her insurance, they really only had one option. So Ashlyn wrote that organization this letter, hoping it would convince someone to let her in.
Hi, my name is Ashlyn and really wish to take part in your treatment program. I have heard very good things about your facility and I believe I would greatly benefit from your programs.
The group said no. It said it didn't have a program that could adequately address her needs. Had the group said yes, or another program been available, Ashlyn would have been there instead of home the day she died.
That's our goal, is to not turn anyone away.
Mary Gail Frawley O'Day is a psychologist. She runs this nonprofit, Presbyterian Psychological Services. She says the problem is many mental health providers don't take insurance. They're so in demand they don't have to. But even if providers do take insurance, a lot of patients face another hurdle: very high deductibles.
Do you find that folks will forego treatment that they could benefit from because they just don't have to pay that deductible?
Yes, and you know, the irony is it's often the people that need it most that have less access.
This was just some of Ashlyn's personal things that I had brought from our old house.
Quick hopes insurers cover more medicines and treatments, lower their deductibles, and cut the red tape for all the other Ashlyns out there.
She loved everybody. She would accept anybody for who they are, loved anybody for who they are.
Anybody but herself.
Such a profound story,
Yeah.
showing why this is so important to talk about.
And she's just so beautiful. You wonder what she would have become. I mean, just
Yeah.
every time I see it, that's what I think.
Vibrant.
Yeah.
Absolutely. Now, I know, Jason, that you're talking about the insurance portion, too.
Yeah, sadly, when we're talking about insurance coverage for mental health issues, their story just isn't unique. A recent study found 1 in 4 Americans reported having to choose between mental health treatment and paying for daily necessities.
And I know that you did some work and found some options for people who struggle financially or who don't have insurance.
Yeah, well, Erica, there's a nonprofit right here in Charlotte that provides mental health services for free. That's right, for free. Promise Resource Network is on Hawthorne Lane. You can make an appointment or you can just walk in, your choice.
You don't need a referral to come here. You don't need certain insurance or have no insurance. You don't have to have certain diagnoses. We work with people that want to be here.
Now, if you can't get to them, Promise Resource Network will actually come to you. Again, that's all free. Here's the phone number, 704-390-7709. I also found another nonprofit that helps with lower cost prescriptions, a very good group. I posted all of that on the WSOC app.
Jason, thank you.
Sure thing.
Untreated mental illness.
It continued to escalate.
Can pull some into a cycle.
The next step was the robberies, then the jail time.
It's hard to break free from.
When it's too hard to go get help and go to mental health and fill out all these paperwork, he doesn't have a clue. He's never paid a bill. He's never had a job.
What one group is now doing to get young offenders the help they need to change.
Steve Smith Sr., touchdown!
One of the best receivers in the NFL opening up about his struggles.
On the inside, I'm just broken.
Former Panther Steve Smith on getting help and getting rid of the stigma surrounding mental health.